Okay, thank you. Great. Okay, we'll get started now. We are recording. Good evening. My name is Reverend Nicole Harris. I am the president of the Schenectady branch, branch 2175 of the NAACP, and we're so very happy that you could be with us this evening. We are having an important discussion tonight as it pertains to Ellis Hospital and what is happening there. Part of the mission of the NAACP is equity and equality for all. And so this popped up on our radar. People brought it to our attention that they were concerned about some of the changes that they perceived that were going on at Ellis Hospital. And so we want to thank the administration from Ellis, who's here with us tonight. I'll allow them to introduce themselves after the head of our health committee introduces herself. We want to thank them for taking the time tonight to answer questions. So just a few house rules. I'm going to ask if everyone can stay muted if you are not participating in the program or answering the questions. I'm going to ask that you stay muted and that you can, however, have discussion in the chat. We did receive questions through our website. We have some really good questions, well thought out questions. I can tell folks did their research with these questions that we received. And so I want to respect that those who submitted those questions. And so we're going to ask those questions. And if we have time, maybe we'll get to questions that are in the chat, but I just wanted to put that out there in the beginning so that everybody knows how we're doing this. But we want to be fair to everyone and to all of the questions. So I think that's it. I may have some more house rules. Oh, in the chat, we do ask that you would be respectable in your language. Not that anybody's come here to say anything, disrespectful, but we just want to ask, okay, house rules that you would be respectful in your chat and everything here on Zoom. Okay, so at this time, I'm going to introduce Nikita Hardy. She is the chairperson for our health committee. Nikita.
Good evening, everyone. Thank you so much, Pastor Harris, for your time, and thank you for the introduction. My name is Nikita Hardy. I'm the chair of the health committee for the Schenectady branch of NAACP, and I'm really happy to have our local community and supporters here on this very important conversation on what's happening in our community. Thank you to Ellis Hospital, Paul Milton, and his CEO, Leslie Ann, for their time this evening.
Thank you so much. And at that, we're going to go ahead and throw it over to Mr. Paul Milton and Ellis Hospital to introduce themselves.
Okay, thanks, Reverend Harris, and thanks, Nikita, for the work that you're doing. And similar to you, and we'll get into this later, our goal, our mission is equity for everyone, particularly health equity for everyone in the community. So we do share that mission, and our board does take it very seriously. So I do want to introduce myself and my colleague here. My colleague is Leslyn Williamson. Leslyn's been with Ellis for 5 years now. She's doctorate trained, educated, brings a lot of skill to the position, very, very much involved in the community. Particularly during the pandemic. I'll talk about that in a minute. But has been a wonderful partner for the executive team here at Ellis, going through all the changes that are in front of us. I've been here at Ellis. This is coming into my 14th year. I've been the CEO now for 6 years. And so working with the board and the medical community and a lot of the other community-based organizations here in Schenectady, working through a lot of the changes that are going on in healthcare, making sure that everybody really has reasonable access to good healthcare services. So, so with that, we're grateful for the opportunity here. Leslyn and I have really been hitting the road on our communication campaign. We've had a lot of one-on-one meetings with leaders. We've had a number of group meetings like this one. We are just appreciative of the opportunity to be with you and want to listen to your questions, answer the questions, and really remove a lot of misinformation that's out there in the community, which is why we find this very valuable. so that we can clarify a lot of the things that you may have. So we appreciate the questions and want to get to them as soon as we can. But if it's okay, Reverend Harris, I'll just make some introductory remarks, if that's all right.
Sure, that's fine. Yeah.
Okay. So with that, at the end of this, we'll come back to it. My ask is that, Ellis is our community hospital here. And my ask of everyone is that we get behind it, even with all the changes going on, but that we all get together and support the community hospital. We all know we need a community hospital that's thriving and really able to adapt to the changes that are going on in healthcare. I'll speak to that a little bit in a minute. Let me just talk about a couple things today, and I noticed there are quite a few women on the Zoom here. As you know, October is Breast Cancer Awareness Month. Today, we had what we call the Janie Award as part of Women's Day In. We used to be Women's Night Out as an event. Now with COVID, it's Women's Day In. We honored a physician, Dr. Sarah Raymond, who's a radiologist. She gets the Janie Award. That's after Jane Golub. And for those of you who have sort of not done your preventive care, maybe with mammography and being breast cancer awareness, I ask everybody to do your best to take care of yourself. And that's what Dr. Sarah Raymond does. She's a breast cancer expert. She's a radiologist by training and does a lot of the readings. So maybe you may know her, but it was exciting to recognize her and then bring awareness to women's health issues. Not only sort of breast cancer, but with Bellevue, we do a lot of prevention work around cardiology disease. And as you may know, I think cardiology disease for women is the #1 killer. So that's my other pitch for all the women here is do your preventive work. We've got some screening work we do at Bellevue to make sure that you're heart healthy and also sort of cancer healthy, if you will. So it's a little bit of a pitch there while we're in the month of October and sort of recognizing Jane Golub there. So as you know, we're in the midst of a public health crisis with COVID. We sort of as our or your community hospital have tried to do our best. I think we should all be proud of the work we've done during COVID. I think the results in Schenectady, at one point, I think we were one of the leaders in the state in terms of the number of people 18 and over who were vaccinated. So if you had a big part in that, I thank you for that. I think it helped keep our community healthy. Leslin and I have worked with the public health officials at the county level. Keith Brown. We talk with him weekly. He's a great guy, and I give the Schenectady County Health Department a lot of credit. But I think they've done a great job, and we've been good partners with them to try to stay ahead of COVID. But as you know, it's still out there in the community. We're not, even though we have our masks here. You can see, for those of you that can see us, we're not masked right now. We're vaccinated. But we do have our own protocols here that we follow, that if you're sort of outside in the public hallways here and sort of in areas that are more in the public, that we mask up and do that when we leave here. But the mandate for healthcare workers, as you know, was put out by the governor. We've reached a little over 96% of our employees getting vaccinated. We did have a number that have a religious exemption, and as you may know, that's been withheld. So we have a number of our employees who have a religious exemption. And we did have, I think, about 15 employees, a mix of part-time and full-time, who chose not to get vaccinated. And because of the governor's mandate, they're no longer with Ellis. And that has just happened over the last several weeks. So it's unfortunate, but again, I think as a community hospital, we're able to still do what we need to do to serve the community. That part was not a disruptor for that. For those of you that may not know, it reminds me a little bit. In many years ago in the 80s, I was a Peace Corps volunteer in Malawi, Africa. Malawi is the 5th poorest country in the world. And we did a lot with vaccinations and prevention work. There were issues of bilharzia and cholera and TB and malaria. And there was such a push to do your prophylactic medicine or your vaccines. But it's interesting, in the poorest, one of the poorest countries of the world, if medications were available, there was a real hunger to get the medications that were available. And it's interesting for me to see it here in this country because a number of the issues we have going on, that even though the medications are plentiful, there'll be some folks who choose not to get it. So again, a little bit of my pitch that the medications are there. We're fortunate in this country. We're able to create this vaccine in a short amount of time. It's available for everyone. We did have we have 24 inpatients today in the hospital who have COVID. It's leveled out to that number over the last month. We did have an individual yesterday who died, 29 years old, African American, a number of health issues, obesity, I think diabetic, but was not vaccinated. And it really pains me that we lost her. And sort of, my heart goes out to her family, her friends. It may have been a death that was avoidable had she had the vaccine. So again, a little bit of a pitch that if you're not vaccinated, to please consider it and get vaccinated. So having said that, as I mentioned earlier, our goal at Ellis is pretty straightforward, like yours, is to take care of everybody in this community to the best of our abilities. And we pay particular attention to those that have challenges, whether they're financial challenges, mental health challenges, physical health challenges, even if they have, spiritual challenges. There's folks out there that have a lot of challenges, and we need to make sure that with them and those challenges, that they get good access to reasonable health care. I think it's fair to say healthcare is going through a lot of changes right now, and your community hospital, Ellis, has to adapt to those changes successfully. A couple things that I think are very positive for this community. They're exciting. We've developed a partnership with the Roswell Park Comprehensive Cancer Institute out of Buffalo. It's a national, if not internationally known, cancer center. It was willing to partner with us. We put out a sort of a letter of interest, who's interested in coming to work with Ellis to expand cancer services in Schenectady. They responded. They're a great organization. They have great cancer clinical trials, sort of research, things that people in this community would not have access to. It started last month in September. The physician, who's a Roswell Park physician, a medical oncologist, Dr. Mahmood, started last week, and I know her schedule is getting busy now. So it's exciting to offer this and bring these level of services to everybody in Schenectady. So that's exciting. Earlier in the summer, we opened up expanded mental health services on State Street. We expanded our child and adolescent outpatient services. Again, intentionally put it there in that part of Schenectady in the community so that there's good access. And as you know, and some of it is related to COVID, there's more mental health issues. There's quite a few in this community already, but COVID, I think, has made it somewhat more challenging on the mental health side. And so we're excited about expanding those services here. I think we should be all grateful that there are a number of donors in this community, people who do have means, who pulled out their checkbooks and wrote gifts to be able to expand that. So I think it's a real positive that our community is blessed with donors like that, who want to focus on mental health services, and we're able to expand them for everybody in this community. The other issue I want to speak to, and then we can probably get to some Q&A, Reverend Harris, I'll leave it up to you, but is the affiliation with St. Peter's. And so you ask, well, why is that? And I think everybody needs to know in today's day and age in healthcare, at the national level, at the state level, and even at the regional level here in the Capital Region, an independent standalone hospital is not viable. You have to become part of something bigger. So then if you ask the next question, well, why do you have to become part of something bigger? The short answer is physicians today who are coming out of training, residencies and fellowships, want to be part of something bigger. And existing practices in the community, ourselves included, Ellis, but other private groups you may have seen, have been challenged to recruit physicians when others have retired. And so scale or size matters in healthcare right now in a big way. For those of you that may be familiar with some of the hospital systems down in the city, in New York City, there's essentially 5 systems that cover basically all of New York City, the neighboring counties, and Long Island. In the Capital Region, as you may know, Albany Med has partnered up with Saratoga Hospital, Glens Falls, and Columbia Memorial down in Hudson. St. Peter's has partnered up with Northeast Health going back 12 years ago. And so you have the St. Peter's Health Partner System. We're essentially one of the few standalones left in the state. It's not a viable option in the future. Our only option is St. Peter's. Albany Med is not interested in Ellis. So our only option is St. Peter's, and we have to make it work for this to be a thriving community hospital in Schenectady. So my ask is that everybody here get behind it and support it. What we have in front of the health department now relative to this affiliation is what's called a management services agreement. It's kind of like a consulting agreement, kind of in layman's terms, that we would get some management expertise from St. Peter's to help Ellis get more size and more scale, to help improve our financial position and the quality of services that I was talking about, which has a lot to do with retaining and recruiting physicians. The health department needs to sign off on the management agreement. We're waiting every day now for the health department to approve it and the governor's office. If they don't approve it, my concern is, and I want to share this with you and be very frank with you, I'm concerned that the services in Schenectady will decline over time, that we will not be able to provide the services we need to if we don't get approval for the management services agreement. The management services agreement is a 2-year agreement. No services would change at Ellis during the time of those 2 years. No services at all. And I need to underscore that because that's one of the misinformations that's out there. No services would change at all over the next 2 years. If after 2 years, we became part of St. Peter's in a merger, that requires going back to the health department and requires a full, what they call a certificate of need, which is a full public hearing process where everybody in the community can express their comments or concerns. In a management services agreement, it technically doesn't require that level of approval, but given the nature of misinformation that's out there, it's caused concerns at the health department's level and at the governor's office level to go forward. And one of the important issues that gets raised is abortions with a Catholic entity. I want to underscore, in a management agreement, no services would change at all for Ellis. So Ellis would continue to do abortions, which we do at our Bellevue campus, and we do approximately 50 a year. That would continue over the 2 years. If, and that's a big if, but if we were to become part of St. Peter's in 2 years, the only thing we would not be able to do would be abortions. And I'm very pleased to say that we've worked with Planned Parenthood in this community, and they've been wonderful partners. And I think they're on this call this evening. They've been wonderful partners and have been willing to work with us to make sure that there's reasonable access to all services. Even though nothing would change in the management agreement, if we got to a full merger in 2 years, there would still be access to abortions in this community in working with Planned Parenthood. So I want to underscore no changes during a management service agreement. If we were merged, the only thing would be the abortions, but they would still be provided to in this community. So that's what I want to go back to, Reverend Harris, and underscore what you said is that there's good access for everybody in this community, particularly those that may be challenged, that we're here to serve them. And I think this affiliation, this management services agreement, and the eventual merger ensures that there's viability and a path forward for Ellis being a strong community hospital. If it falls apart, and I'm not saying this in a threatening way, so don't take it that way, but if we're not able to become part of St. Peter's, I do believe, in my opinion, there will be a decline in services for a community hospital over time. I'm reading some of the comments in the chat. Do you want me to respond to those, Reverend Harris? Or do you want...
Not quite yet, only because some of those questions are answered are asked in the questions that were submitted online.
Okay.
So I do want to encourage everyone, continue to make those comments in the chat, because I am looking at them and I'm actually kind of cutting and pasting and putting them on a Word document so I don't lose them, because some of those are asked in the questions that are submitted. So, and there are some things questions that have popped up in my mind now that you've said some things. But let me thank you, Dr. Williamson. Thank you for being with us today. And I do want to get to the questions, if that's okay. Are you guys ready to do that?
Good. Yeah, I just wanted to sort of set the table with those issues, and then it ready and willing to go with the Q&A.
Okay. All right. So we're going to go ahead into the questions, and please continue to post questions in the chat. We will look at those as well as we're going through this. Okay. So this question reads as follows. It was front page news that St. Peter's is one of the most aggressive medical bill collectors in the state and disproportionately sue people of color more. They put liens on people's homes, garnish wages, and charge exorbitant interest rates, 9%. And add to that, the Ellis Emergency Department now includes in-vision doctors, notorious for surprise billing. What are you doing to prevent, track, and protect us from surprise billing and aggressive collection from happening in Schenectady?
Well, I'll take a lead on it, and then if Leslin wants to fill in. First of all, let me talk about the surprise billing. Surprise billing is a big national issue, not as much in New York, quite frankly, because New York took some very important steps years ago. So what is surprise billing? Surprise billing generally is you show up many times it's when you go into the ER, there may be a physician who comes in and sees you, who may not be part of your company's insurance plan, and they take care of you, and they send you a bill, and it surprises you because you can't believe how high the bill is. In New York years ago, they put laws in place that the bill had to be no more than what was called reasonable and customary for that area. And so that law is in effect, And so surprise billing really isn't as much of a New York State or a capital region in that case issue. So I think we've benefited from that. In terms of other bills and people who don't pay their bills and we go after them, I can only speak for Ellis. I've heard the anecdotes about St. Peter's or Trinity. I've actually never seen a report that holds them out as being sort of scoring them worse than others. And so when I say than others, hospitals around the country, and I don't think Ellis is really any different, if someone doesn't pay their bill, regardless of who they are, we have a protocol we use to make sure that we can sort of get billed, get paid for the work we do. And so for someone who may be lower income, doesn't have the means to pay, we have financial counselors that they'll work with to go through sort of a review of their assets or their income to determine what's reasonable to pay. And I'm not going to say we're perfect by any means, but that's the policy that we have. And I think our procedures overall follow that. And I think we're very much consistent, to my knowledge, of what the other hospitals do in the region, be they Albany Med or St. Peter's.
And I'll just add to say everything that you just said, Paul, is absolutely correct. From the Ellis side, I do not know what's happening to St. Peter's with their billing practices, but certainly for Ellis Medicine, our finance team truly work with our patients to ensure that if they don't have the funds to pay for the services that we render at Ellis Medicine, that they work with our finance team to set up whether it's a payment plan. And we are also required to have some percentage of charity care that we do provide at Ellis Medicine.
And we do have a compliance department. And so, the compliance department has to ensure that we're complying with the regulations that are out there. So if in any case we fell outside a certain standard in the community, it would come to us, it would come to our board, it would come to our compliance and audit committee, and we would review the data. Again, that's why I'm saying, I'm not holding us out that there's not an anecdote here or there where a situation may have occurred that we may have had to focus on it and correct it. But I think overall, it has not risen to that level where we're outside a reasonable standard for the community. And again, to my knowledge, nor is St. Peter's, nor is Albany Med in terms of being an outlier in their practices to receive payment for the work that was performed.
Okay, so I'm gonna have to move forward for the sake of time, but I do see in the comments in the chat that folks have posted some articles that have spoken to this aggressive billing. And so as the young people say, they came with receipts tonight. So read those, when you get a chance, read those articles. Not, I'm speaking to everyone who's here. So
We
there's
appreciate
more.
that.
Yeah.
Those, anything that's kind of out there in the literature that has has some backing and some investigation behind it, I think that's very helpful for us to see.
Yeah. Okay. Well, we're going to move on to the next question. Says studies have been done and it's been reported in the news for years that access to health care and health outcomes are very different by zip codes. Hamilton Hill has much higher rates of diabetes, asthma, ER visits for chronic conditions, more mental health, lower life expectancy. How will this merger reduce those inequities?
So I'm going to go back a little bit and repeat what I said. I mean, I'll start with Ellis. We're very familiar with the data, and as many of you may know, there's a community needs assessment that's going on in the community now. In fact, if we can get you that survey, I'll make a note that'd be helpful for folks on this call to fill out that survey. In the past, to your point, the survey has shown that in terms of community needs, mental health issues arise which is part of the reason I'm going back to what I talked about earlier, expanding our State Street campus on mental health. Diabetes, obesity have risen to the top in terms of community needs. We Ellis do have, you probably know, the Family Health Center in the community. We try to reach out into the community so that there's reasonable access. I'm sure there's always more we could do, and maybe it's helpful for ideas here if there's other things we could do, if it's transportation or those kinds of things, to make sure folks can have access to their physician. And the other one, I think, that rises to the level is tobacco use and smoking. And that's one of the issues. The other, I think, one of the top 3 issues that we've tried to work on is smoking cessation. So smoking cessation, diabetes, obesity, and mental health are issues that have been identified in the past that we put into our planning to focus. And to your point, Reverend Harris, in those areas that may be challenged, whether it's with transportation or access to care. And we're familiar with the data too. We know, based on the zips, where some of the challenges are. We've noticed it during COVID, why we did some of our pop-up clinics in parking lots in Mount Pleasant and Hamilton Hill to try to provide reasonable access for folks there to get tested.
Okay, thank you so much. The next question. Has Ellis considered excluding Belleville from the partnership so that Belleville may be independent from religious restrictions?
So the religious restrictions, sometimes referred to, from some of you may know, the ethical and religious directives. Those are part of the Catholic Church. Those are the things that identify those prohibited services, like an abortion. The answer, we've discussed the issue of putting Bellevue as separate, but there's a problem there. Bellevue won't survive as an independent hospital. It would go, quite frankly, financially upside down. The way it survives, it goes back to my point of being part of something bigger. It's part of Ellis, and the scale it gets with Ellis, quite frankly, keeps it surviving. So that's number one, is that Bellevue as an independent would not make it. And I know that because if you go back to the Berger Commission in 2008, Bellevue was on the brink of going bankrupt. And so it became part of Ellis with St. Clair's to survive. The other issue is, as an interested party looking to work to partner with Ellis, Bellevue actually is considered a gem. It's considered a very good service to the community. If it wasn't part of Ellis, St. Peter's would probably step away from its interest in Ellis.
Okay, so Bellevue is an asset in that way, that it kind of makes the St. Peter's is more interested in doing the partnership because Bellevue is a part.
Correct.
Okay, so I want to understand what you're saying here. So Bellevue could not be excluded from the partnership because of that reason, or is Bellevue being included, keeping Bellevue's doors open? Like, so if you could just kind of tell us why it would not be, yeah.
St. Peter's is interested in all of Ellis. The women's services, the cardiac services, the mental health services, the ER services, all of the services we do. If Bellevue wasn't part of it, which is a significant part of Ellis, St. Peter's would not be interested in Ellis. Is that okay? You understand that? You're still on mute, Reverend Harris.
Okay. Yes, I think I understand. Okay, so, and I see some things, I do want to get to this because there have been questions that were submitted, and I've seen them in the chat here, about what is actually in writing in the partnership and what has been made available to the community in regards to what's in writing?
Yeah, so what's in writing right now is a management services agreement. And that's what's in front of the health department now. And we've been going back and forth with them, trying to finalize it. My commitment, and this goes with St. Peter's as well, my commitment is once we have that document, after all the edits are made and it's a good, clean document, we will share that with the community. We're not going to hide it and throw it, in a secret box. We want to share that with the community to remove all the mystery or uncertainty so that it's clear what's in the management services agreement. But it's difficult to share it right now because it could change from one day to the next. And to get a clean document out, with every edit is very difficult to do. So we're getting to a final document now. And if the health department approves it, we are fully committed to be transparent and share it with the community.
Okay, so what does that process look like? So, okay, if you're waiting for the health department to approve it.
And the governor's
Right.
office, and the governor's
Okay.
office, correct.
And the governor's office, and then at that point, does it become where you can share it with the community?
Correct.
Okay, now how close after it is that approval is it actually signed? I mean, ink on paper kind of signed, because if it's approved by the governor on Tuesday and then signed by Ellis on Wednesday, then the community really didn't have time to look at it. So how does that, what's that process look like? Do you understand the question?
Yeah, I think I do. So we have a board of directors of 15 people. They represent the community. Okay? They have the ultimate authority. So if the governor's office and the health department agreed on a Tuesday that they've signed off on it, and our board is, let's say our board is comfortable with it, on Wednesday, we would share it with the community. The input we're getting right now on the management services agreement is really, I think to some degree, you have to put your trust in the board of the hospital, that they're representing the community, because that's their fiduciary responsibility. And they're doing what's in the best interest of all of us in the community, of what's in that management services agreement. That's their fiduciary role. And then once they have signed off on it, and they're representing all of us, that's their job as members of the governing board. Once they've signed off on that for Ellis Hospital, we as management share that immediately with the community.
Okay. I'm gonna leave it there. You've answered it, but I can see some folks, in the comments having more questions, but I don't want to. Okay. Let's go. I'm gonna go to one other question, and then we had a lot of questions come in about reproductive health. I kind of try to combine some of the questions. I know you've answered some of it already, but I think we do have to go to it because we have a lot of questions that came in. But this is one question not related to that, so I'm going to ask that, and then we'll go to reproductive health. Okay. Let me pull up this question. Okay. Excuse me. Recently, Ellis closed its dental clinic on McClellan at McClellan campus. Now there are incredibly long lines at Hometown Health for regular preventive dental care. And for emergencies, patients have to wait all day, even though many people can't because they have to work and take care of their family. The lack of dental care is a disaster in our community, especially because this clinic serves so many people who don't have the money to afford a private dentist. Ellis must have known this was going to happen. Have you been tracking this other than renting Hometown Health space at its old clinic? What is Ellis doing now to help this situation it created? And I'm reading the question as verbatim as it was submitted.
Yeah. So very good question. I want to underscore a couple points. Ellis is in a distressed financial position. And I think it's very important for people to know that. And I'm not saying that in any kind of in a defensive way or a threatening way. I'm just trying to be very factual with people in the community. So Ellis is in a financially distressed position. There were significantly 2 service areas that were losing quite a bit of money, causing Ellis to go almost into a significantly financially distressed: home care and dental. Our commitment is to make sure, as I said earlier, there's reasonable access to care for everybody in the community, but it doesn't mean we have to do everything. So you may know there's very good quality home care companies in this county, highly regulated by the state. Ellis's home care was losing money. Leslin, quite frankly, did a ton of work to work with the State Department of Health and the other home care companies to make sure that there was good access for patients, particularly those that we had. We probably had 200 who needed to be transitioned to other home care companies. So there's good reasonable access to home care. Dental was very similar. We were, quite frankly, financially underwater in a big way on dental services. And we had our own long waits and those kinds of things. We weren't perfect on that by any means. Hometown Health, which is, we're lucky to have that in this community, a federally qualified health center, has a dental clinic, or had a dental clinic at the time, that was much larger than ours. And they can expand it. Now they get paid them, it wasn't based on a hospital doing dental work. I'm getting a message, my internet connection's unstable. Can you still hear me?
And we hear you now. Froze for a second, but you're good now.
Yeah. So my comment on dental was, we're lucky to have a federally qualified health center in the community. They get paid differently for dental work. They get paid better than we do. It's a financially viable organization for us. Hospitals get paid significantly less for dental care. It was not financially viable for us. We had long waits when we were doing it as well. I'm not going to say we were perfect. They were much larger than us in the dental care they were providing. And so we could partner with them to make sure that there's really good access for dental care in this community, reasonable access. Leslin and I have stayed close to it. We had Joe Gambino's the CEO over at Hometown. I'm drawing a blank on the dentist who is over there, who leads it. But we worked with them during this transition so that they could accommodate our dental patients into their service. We would move our staff over, they'd become part of Hometown Health staff, and we would continue to serve the community, but it would be under the banner of Hometown Health. And that's our commitment, to partner with others. We don't have to be all things to everybody. Will we have some growing pains to work through it and work with them to make sure that they can, reduce the wait times? Yes. As you probably know, they have a plan to expand next to their site on State Street to move the dental clinic and continue to build it out. So I think, as I said earlier, quite frankly, Ellis needs your support to make Ellis a thriving community hospital, even with all of our, quirks and challenges that we have. We need your support to work with us. I would say the same with Hometown Health. Not going to be perfect, but we need to get sort of our shoulders behind Hometown Health and make sure that they're the world's best community health center here at Schenectady. We got to get together and make sure it works. Not going to be perfect all the time, but let's get through it and work together with them.
Okay, thank you. The next question. Okay, in every media article I have read, Mr. Milton says that reproductive services, including abortion, will not be affected for 2 years, assuming the merger is approved. What will happen to those patients after those 2 years? What about abortions after 8 weeks that cannot be performed at Planned Parenthood? Where will those people go?
So I got a little bit of an echo there. There are certain services that are complicated that, again, it may be outside of our scope. Many times, like in the ER, we'll stabilize a patient and transfer them, let's say, to Albany Med. I'm pleased to hear that you're picking up in the articles that nothing would change for 2 years. That makes me really happy to hear that you've picked that up in the articles. After 2 years, if, and again, that's a big if we were part of St. Peter's, the only service we would not provide would be abortions. Tubal ligations and everything else, those kinds of procedures, we would continue to do. There's a model that I've talked about with the press that's called the Dignity model. Dignity is a health system on the West Coast. What it means is we would do those procedures, and the dollar that we would receive for that from an insurance company, we would give that to another not-for-profit in the community. So it wouldn't go into our books, if you will. So we would continue to do those procedures. I use tubal ligations as an example, and using the Dignity model, take that revenue and gift it to another not-for-profit. That would be after 2 years from now. If there's a certain clinical situation that presents itself that's complicated, then again, we would stabilize that patient and transfer them to Albany Med.
Okay, you said you would stabilize them and transfer them to Albany Med. So Albany, okay. And then you said something
There's
about.
not very many of, I'm sorry to interrupt, but there's not very many of those every year, of those patients that need to be stabilized and transferred relative to a termination of a pregnancy.
Okay. Okay, thank you. Okay, I'm trying to, I have, okay, so this question, huh?
So I know it's hard to read it and then try to facilitate. You're doing a great
Yeah,
job.
no, I'm trying to make sure I'm not asking you the same question over and over again. And I know some of the questions are similar, and I want to just honor that we had so many people that submitted questions, and we appreciate it. This question, short question, it says, if I have a C-section at Ellis and I want to have my tubes tied, will that service be available for me at Ellis or Bellevue?
So let me just say, what goes on between the physician and the patient? And I'm paraphrasing what Dr. Reed at St. Peter's has told me. The Catholic Church does not get involved in. In your example here of a procedure, a reproductive procedure being done, if that was done for prevention of cancer, for example, that's not a prohibitive service. If that's done to prevent a future pregnancy, again, we could go back to the Dignity model. We would take the dollar we receive for that, and we would give that to another not-for-profit organization in Schenectady. So we would be able to do it if that's the question.
Okay, when you're saying you'll give it to another non-for-profit organization, you would give it to a non-profit that provides those services? Is that the Dignity model? Because I'm not sure.
The Dignity model, and I'm not an expert in this, so I'm going to speak in generalities because we haven't gotten obviously to that place yet. But there's a lot of very good not-for-profits in the community, whether they're food pantries, whether they're the city mission. We would have a committee of the board that would look at criteria at that time to see how to take that revenue and what organizations in the community meet the criteria that would be developed, which has not been developed yet, to give that revenue to. But as you know, there's a lot of great not-for-profits in Schenectady that would be very interested in receiving those dollars for the work that they do, whatever the priorities may be in Schenectady.
Look, it's so funny. I'm sitting here looking at me and Nikita face. We both making the same face. We're going, wait, what? But no, then let me tell you how my mind is working right now. Okay. And you know, the position that you and Dr. Williamson are in, okay, is not an easy one. The healthcare system itself, all the changes that have been made, okay, and the ethical things. You know, I'm a preacher. I'm not a doctor, but I have to take class on ethics, right? You know, so that I don't. And you try your best to be ethical in your practices, but when the system itself is not ethical, it's difficult, right? And I'm saying that, and I'm not saying that to say I have compassion for what the seats that you sit in. But here's what I'm hearing as you're saying that we take, you know, we take money and we give it to a nonprofit. It's almost like a trade-off, like, okay, we're not going to provide these services, but instead we're just going to give money to somebody to say we did a good thing, but you're not necessarily giving money to anybody who's going to provide the services that have been eliminated or cut or whatever. So I don't understand. It's like, I don't know if it's that good of a gesture if it's not really still getting the services to the people. So I don't know.
Well, the services are still there for everyone. And if the abortions are done by Planned Parenthood, all the services are here in the community. I think what the Catholic Church is basically saying is there are certain things that they are in the ERDs that they prohibit doing. In the dignity model, those things, aside from the abortions, they would say you continue to do them, but they don't want that revenue going into the church. That's the dignity model. But they understand there's other needs in the community. So keep that money in the community and give it to someone else. But we're still providing all the services, the health services that we would be doing here. Actually, I think the community benefits because we would take it on the chin by not putting that revenue into our coffers. We're still providing the work, but we would give that to a partner in the community that's doing other good work for, you know, for particularly your point about health equity and people that need services here. So I think it's a very, to your point, sort of ethical model and a very reasonable model for health systems like Ellis to be able to work through these challenging issues and provide access for care for people in the community. I think you know, as you started out, that's what we all want at the end of the day, is really good, equitable services for people in this community. That's what it's all about. That's why we all work so hard at what we're doing. And with the challenges coming, and this is our only option with St. Peter's, you know, with the complexities that go with a Catholic organization, I think we all have to get together and do our best to make sure it works to the best of everybody in this community. If we go through down the path of trying to pick it apart, I'll go back to what I said earlier. I think services will decline over time in this community. I don't want everybody getting hung up on some of these issues because then I'm worried that other services will decline over time. I don't know what they would be, but I'd be very concerned about a number of services in the community declining over time if we don't all get together to make the St. Peter's thing work.
Okay, so I'm going to throw my own question in there now to what you said. So if this partnership does not work out, is Ellis in jeopardy of closing its doors or something like that?
I don't think it's in jeopardy of like closing its doors, because I think, as we all know, in a very logical and even your point about being an ethical way, the health department knows you need a community hospital here, but you could have a very sort of skinny down community hospital, or you can have a very expansive, robust community hospital. My concern is over time, you end up becoming more of a skinny down hospital because you're not going to be able to attract physicians. You're not going to be able to provide all the services that we're very fortunate enough to have in this community today. But if we don't get a partner and we start maintaining these and building them, we're going to be in a very challenging position going forward. I can tell you in the last several months, because of the uncertainty that's out there and the health department's nervousness and the governor's office nervousness behind this, because some of the concerns that I think the activists have raised on these issues to the governor's office, we've seen physicians resign and leave Ellis, and we will not be providing probably these services going forward the way we've been comfortable expecting them, because we're going to be very challenged to recruit physicians. I'm not optimistic we're going to do that in a reasonable way over time. And there's some very significant services that where physicians are resigning that are going to negatively impact this community. So I think you'll have a hospital, Reverend Harris, but I don't think it'll be the hospital that we've all come to know over the last decade of what Ellis is. It'll be different over the next decade. It'll be less of what it is.
Okay, thank you. In this whole process, what have you found to be the most challenging in this whole process?
To get the community to support this, which is why I'm so grateful that you invited, that we set up these meetings and clarify the information so that we can get the community surrounding this, understanding it, getting rid of the misinformation that's out there, and getting the community on board and sort of writing letters to the editor, calling the governor, calling the health department and saying, I need my community hospital to thrive. I need it to be able to recruit physicians. I've been told the only way that's going to happen is that they're part of something bigger. The only interested party is St. Peter's. We've got to get behind this and make it happen. We'll work through the women's reproductive issues. We've got a good model. We've got a dignity model. We've got a good partner with Planned Parenthood. Let's get behind it and make it happen ASAP. That's been probably the thing that's been the hardest.
Okay. We also had a question that came in. I'm trying to find it, but I'm paraphrasing. It talked about the, I guess, agreements that the doctors would have to sign, maybe with even in the first 2 years of this partnership. Let me just ask flat out, since I can't find the question. Would doctors have to sign agreements to say things like, we can't give contraception, we can't talk about reproductive health, like, I don't know, anything? Would the doctors be restricted in any way?
No, the only restriction the doctors would have is they would not be able to perform an abortion.
And that's in the first 2 years or only after the first 2 years?
That's if you're, so let me back up. Right now, today, because of the challenge on physician recruiting, we, Ellis, are looking to transition our physicians to St. Peter's, and we hire them back. So you probably would never know it. If you were going to a doctor on a Friday and went to that doctor on Monday, Friday they could be on Ellis's payroll, and on Monday they're on St. Peter's payroll. As a patient, you would never know. Services are still here in the community, but they have a new contract. They're on St. Peter's payroll, but still working on all the Ellis sites. So think of it like as an outsourced service, contract service coming in. As a employee of St. Peter's, they can do family planning discussions. We've been in meetings with physicians. Physicians have asked, can I still write scripts for contraceptive medicine? Yes. Can I do implants like, what is it, Norplant? Yes. Can you do all those things? Yes. Can you do a tubal ligation at Bellevue? Yes. In that case, we would gift the money away in a dignity model if it was a St. Peter's person doing it. Okay, so services would all be there. It's only if you're an employee of St. Peter's doing work at an Ellis site, in that example, is what would happen. But I can tell you right now, the physicians at St. Peter's, the obstetricians, the family physicians, the general practitioners have conversations with patients about family planning, prescribing contraceptive medicine, doing implanting IUDs, doing Norplant. They're doing all of that now. And that's been an open discussion with physicians at Ellis, from physicians at St. Peter's leading those discussions. Am I clear on the answer?
I think so. I think so. I'm
That's a
listening.
no.
Yeah, no, because I'm reading the comments as well that are coming in, and I see one that says they can they do that even after signing the SPHP contract? But I think you did kind of answer that, but I didn't.
Yeah.
And now I'm like, I want to know what the SPHP. I guess that's a
St. Peter's Health Partners, yeah.
Okay, contract.
The question, like a group, a private physician group, not employed by Ellis. So that, for example, a private obstetrician group, I'll use an example, CareNet. Okay, large OBGYN group in the community. They do deliveries, they do procedures at Bellevue. Over the next 2 years, nothing changes. After 2 years, if we were merged, they would not be able to do an abortion at Bellevue. We would work with Planned Parenthood, even starting now, but after 2 years, we would be prohibited from doing that. Planned Parenthood could partner with us to do that.
Okay, thank you. Nikita, did you have any questions? I'm reading some of the questions, trying to make sure I'm not missing anything, but I do want to ask our health committee chair if she has any questions.
One question that did come to mind was in regards to Planned Parenthood, if Planned Parenthood has the capacity, and also if they would be able to handle emergent cases. Because, you know, when we have a lot of these cases that come in, it's not during, you know, regular office hours, and with Ellis not providing that, they won't be able to. So those are the two big questions for me.
Yeah, so Joy Calloway is the interim, I'm not sure exact title, executive director or CEO of Planned Parenthood of Greater New York. She and her team have been on calls with Leslin and myself for a number of months talking about that issue. We've shared with them our data. We've shared with them the number of terminations that we do. We've shared with them the zip codes and the information on the demographics of where these patients come from, which is interesting. Of the, and I said approximately, we do approximately 50 a year, over half of those are from outside Schenectady, which is interesting. But yet, to answer your question, the feedback we've received from Planned Parenthood is A, they have the capacity to do them, and B, they're very interested to provide those services to people in this community.
And Nikita, regarding the emergencies also will still be done at Ellis, because just understand at Planned Parenthood, when there are emergencies, those patients will be coming to Ellis Medicine. Because in emergencies, we have to provide the services for the patients.
So in emergencies, you have to provide the services such as tubal ligation or anything like that. If there's any complications, you have to do so.
Yes, if there's a complication, yes, we have to.
So to say, for example, it comes up sometimes, to save the mother's life, you may have to do a termination of the pregnancy. You do what you need to do to save the life.
Okay. I think we may have time for one. And I have to say, boy, oh boy, even as we're here right now, there's still questions coming in. My phone is zing, 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 emails coming in with questions that are being submitted on our website. So we certainly may have to come back at another point and have another conversation. And I want to thank you again for your willingness to meet with us today. So I'm gonna pull up.
And again, we're happy to do it, Reverend Harris, because as I mentioned earlier, when you asked what is one of the biggest issues out there, is clarifying things and reducing the misinformation. There's so much misinformation that's out there. This is extremely helpful for us to clarify issues and work through the questions. We're happy to make ourselves available to do it. And if if you get the questions ahead of us, we can put them in writing, get them out there ahead of time, whatever you want to do.
Yeah, maybe we can do that next time, get a lot of the questions in. Okay, so here's now, and I think you've answered some of this, but I think we need to maybe go back just for clarity on certain things, because you mentioned before that there would not be any changes made within this 2-year period if the
Correct.
agreement is approved. But then there was a question that was submitted that listed changes that have already occurred. So I'm going to read that question verbatim as it was submitted, okay?
Okay.
Although
Yeah.
you've answered some of it, but let's just read it. It says, emergency department outsourced, visiting nurse service eliminated, dental residency program eliminated, aggressive billing and collection practices by SPHP, MSA submitted without making details public. My questions, given what's been highlighted, what would you say to the low to moderate income families in Schenectady County? In Schenectady County, and what can you assure, and how can you assure, I think is what you're trying to say, them about their future access to quality health care?
I would say that I think everybody here needs to know that the Board of Trustees, the Board of Directors at Ellis, takes this issue extremely seriously to make sure that everybody in the community or the city of Schenectady gets taken care of, particularly those with challenges that I mentioned earlier. So those that are poor, those that have mental challenges, physical disabilities, whatever, our commitment is to be there. If I was looking in front of them right now, I would say, you need to know your hospital is going to be here to serve you. And that's a big reason why we're partnering with St. Peter's, so we can make sure we can maintain the services we're doing and build them for the future. That's why it's so important that this happen. So we're going to be there for you. Will changes occur? No, none of us, none of you, not me, have the crystal ball of what the future of healthcare is. All we know is that it will change over time. I do think there's things that we all have to be willing to adapt to with change, whether it's home care services, dental services, whatever may come in the future, and that we make sure that those people who are poor and don't have means, that we work with them to either get them enrolled in some sort of either Medicaid or services, or if they have nothing, that we work with them in a reasonable way, going back to what we talked about earlier, on some sort of a financial plan that is reasonable for them. We're not out here, we're here, our goal, our commitment, our purpose is to be the best community hospital we can be for people in this community, particularly those that are underserved and have challenges.
Okay, thank you. Okay. Understanding that this is a financial problem that brings us to the table discussing a merger, what other options have been presented to address the financial issues outside of merging with a religious affiliated organization?
Well, I'll go back to I didn't answer your question earlier. I'll go back to the ER physician one. So as I've mentioned, as a standalone independent hospital, it's very hard to hire emergency department, emergency room physicians. There are large companies out there that have big scale, that ER physicians coming out of ER residencies and fellowships will join these big companies and get placed where they have contracts. This company is called Envision. They will provide outstanding quality. We did our homework. We did our reference checks. They have a good history. I'm not saying they're perfect, but they've got a good track record. We've partnered with them for the emergency physicians, that they would provide services here. It became effective April of this year, so I'm sure we'll go through some normal growth and some hiccups along the way until we get in which could be for 6 months or a year, until they get into their own rhythm. And they're struggling with staffing challenges just like everybody else. You know, the other issue, it's a whole nother hour. If you ask me what do I lose sleep overnight, I lose sleep overnight thinking about Leslyn because of the challenges she has in staffing the hospital. It's nurses, techs, therapists, food service, environmental services, you name it, we have challenges on that. But we contracted with a physician ER company to provide high quality ER trained physicians here. And it's financially better for us because we save money by doing this. So it helps reduce our loss on that service.
Okay, well, I'm looking at the time. Um, and we certainly couldn't fit in every single question that we have, but there are important things that we still need to discuss. So hopefully we can come back at another time. I do want to say that a couple of things. One, as you know, I am the president of the NAACP, but my vocation is that of a pastor. And I have to be honest, some of the things that were presented tonight, though it it was mentioned that it's coming from the Catholic perspective and church and things like that. And we know that the Catholic Church is just a part of the religious community. It's not Christianity in its totality. So what I want to say is that some of the things that have been presented to be ethical, I have questions about the ethics. I'm just being honest. I'm just being honest, like, wait a second, and that is not, so anyway, so that could be further discussed. Also, we didn't even scratch the surface tonight about services offered to the LGBT community, which we had questions that came in about that as well. I saw that in the comments, in the chat as well. So maybe we can submit some questions to you about that via email and then kind of see where we can go with answering those so that we can get those questions answered for the community. Yes.
I was actually going to recommend that, and you should send them along to us, and we'll actually send a full response back to all those questions. And still have a meeting, for us to have another meeting.
Yeah. But I think just in a nutshell on that question, we get into it much later. But going back to what you said, we're providing services to everybody. And so there's a paper that Trinity has done. St. Peter's is part of a national organization called Trinity. Trinity's developed a paper on the LGBTQ services that they provide. And so if we can get our hands on that, we'd be happy to share that because that's a commitment that they've made overall for Trinity as well.
Okay, that would be great if we could share that information. Okay, well, I think we're going to close out. Thank you to all those who have stayed and we had some really powerful dialogue going on in the chat. I'm going to ask our Secretary Erica, who should still be on, if she can save that. I think there's a way to save the chat, and we will try to upload this video later. And I think that's it. So Nikita, if I'm missing anything, let me know before we close out.
No, not missing anything. Thank you so much, Pastor Harris. It was a necessary conversation, tensions included, but I'm happy that a lot of the questions were posed.
Thank you so much.
Well, we thank you. We thank everybody, and thank you, Pastor Harris, for helping put this together.
Oh, no problem. Thank you. And I want to thank the community for bringing this to our attention and asking us to do this. It is the goal of the NAACP to serve our community in any way that we can. So thank you for pushing us to do this, and we will continue to share information with you as it pertains to this situation at Ellis. And we want to thank Dr. Williamson. We want to thank President Milton for their time tonight, and thank each and every one of you for your time tonight. And we hope to see you again soon at another forum or at our NAACP meeting, which is the second Thursday of every month at 6:30. You can go to our website to get more information, Schenectady NAACP.org. Is it .org, I believe? So you can go there to get more information. If you'd like to join the NAACP, we would love to have you. The work continues. So thank you all so very much. Have a wonderful night and be safe.
Thank you.
Thank you.
Bye-bye.
Have a good night. Be safe, everyone.
Thank you.
Thank you.